Hi, this is Brian Kim. I'm going to share with you my first impression using the Okulo 1 from Bioniko. As you know, Bioniko has developed synthetic eye models for eye surgery. And so this is the Okulo 1, which is for cataract surgery, and they have different densities. I'm going to share with you my first experience using this model, and I'll be using it in conjunction with the Romano head. And I'll kind of share with you my initial impressions and experience using the Okulo 1 model from Bioniko. So the first thing you'll notice, again, it's mounted on this head. You can see the eye needs to be filled with viscoelastic. I'm turning the eye a little bit, and this is a metal paracentesis incision. You want to be a little bit anterior to the limbus there when you make your incisions. And you know, the Romano head is a nice feature because it's going to simulate the forehead and the orbital structures. And so, you know, it's going to simulate what it's going to be like and the general obstacles that all of us experience when we perform cataract surgery on real patients. This is some dispersive viscoelastic to fill the chamber. And this is my 2.4 millimeter metal blade. Again, stay a little bit anterior to the limbus. And obviously the tissue is not going to simulate real ocular tissue. There's a lot more resistance. And you know, this is plastic, so just keep that in mind. I'm lifting the incision with the chopper and then going in with the phaco tip. But immediately you'll see that as I'm trying to push in, the sleeve just retracts. It doesn't go in. And that's because I pushed. And what I should do, and you'll see later in the video, I kind of shimmy it side to side. And when you shimmy it side to side, then it goes in a lot better. In this case, I just keep pushing and I finally slide it in. Again, having a little trouble finding the incision. You can ink the incision with the blade. So if you wanted to ink the blade first, and you'll be able to see your incision a lot easier. So that's another thing you can do. So I'm removing the surface Bioniko material. Of course, there's nothing there. One thing you'll notice is the lens is rather mobile already. You see, the lens is already free, and there is a pre-made capsular rhexis. So this is the first thing I noticed with this Okulo 1 model, that there's a pre-made rhexis, and the lens is rather mobile already, so you don't have to perform capsular rhexis, and you don't have to perform hydrodissection. So this is the first case, and I'll be performing divide and conquer. And I turn bevel up, and then I begin to sculpt. Going ahead and sculpt the lens. And this is a rather soft lens. You're going to see it's rather spongy. And as I sculpt, I don't really encounter a lot of resistance. But I think this simulates a fairly soft lens rather well in the texture as I'm sculpting. I turn the lens 90 degrees clockwise, and then I start to sculpt again. Again, performing that cross-shaped sculpting trough. Turning the lens with the chopper and sculpting some more as well. So now I go bevel down and I switch to quadrant removal. I slide the chopper under the rhexis edge contra-incisionally, fracturing the lens from the equatorial side and then separating. You can see there's nice separation, and you can see a nice red reflex underneath it. Turning the lens and then fracturing one more time. And now I should have a free quadrant. Trying to grab that lens with high vacuum, it doesn't really want to come. So I lift it with the chopper, fracture the lens, and again, I'm trying to grab the pieces. One of the things you'll notice is, I am in my standard cataract setting. And so that's mistake number one. For those of you who want to try this, don't use your standard technique. And so you can see here in my standard cataract technique and standard cataract setting, I have 0 longitudinal energy. I don't use any longitudinal on standard cataracts. It's purely torsional. And as a result, because I use mechanical fracturing techniques, my CDE is very low typically. And because I don't use longitudinal energy, I oftentimes have really clear corneas post-op day 1. But remember, this is not a patient. This is a simulation eye. And so you want to really maximize settings to help you efficiently emulsify and remove the lens pieces. And so as you can see here, although I'm doing a good job carefully disassembling and removing the lens pieces, it's really rather inefficient. And this really stems from the fact that I'm not using longitudinal energy, and overall my settings are rather low. One of the things you'll also notice is there's a lot of fluid coming out of my incisions. You can see in the upper right hand corner, my bag volume is just dropping rather quickly. But I'm able to, again, very methodically and carefully, I'm able to disassemble the lens using mechanical fracturing techniques. I'm able to position the lens so that the instruments are flanking the lens, and I'm able to crush it rather efficiently. So I'm able to crush the lens efficiently. I'm able to position the lens in such a way that I can crush the lens with the instruments. However, when it comes to emulsifying the lens, I'm really having a hard time eating up all the pieces. With a lens that's rather soft like this, I shouldn't have a lot of trouble. And so as you can see here, because it's really inefficient, I'm thinking that, maybe my handpiece is clogged. So I come out and I flush the handpiece and I go back in. As you see, as I went back to quad mode, I tried to increase longitudinal, but for whatever reason, it was still rather inefficient. So I take the eye off. You can see the base, it has that pink appearance. And that's, again, this is at Romano Head, and that's a picture from their website. You can exchange it really easily. You just pop the cataract into that slot there. So I go ahead and make my incisions again, fill the eye with viscoelastic, make my main incision. And so one thing that I realized only after the fact, I think you really have to make a longer corneal tunnel. By making a longer corneal tunnel, I think you'll have less fluid egress, and you obviously don't want to widen the incision as well. So that's the first observation with the incision as I'm doing the case, because of that fluid egress. And you saw I lifted the incision and just kind of very gently wiggled, and I was able to go in, and the sleeve did not get snagged. And so now I'm going to perform the double chop technique, and I'm going to place the chopper under the rexus edge contra-incisionally, turning the phaco vertically sub-incisionally, flanking the lens with the instruments, and then crushing the lens. So you can see, very efficient. I was able to easily cut through the lens. Again, not quite like a human lens, because with a human lens, if it's fairly dense, it might tilt if you don't execute the technique properly. But this lens, again, was rather mobile, and it just kind of stayed put. And so not very difficult to perform the double chop with this simulation eye. So I turned the lens here, and this is what I mean when I say you have to use both torsional and longitudinal ultrasonic energy. And so with this case, I decide to switch the settings so that I have both, not just torsional, but also longitudinal. So let's see what happens here. So there's a piece of lens material that kind of broke off. eating the pieces up. And immediately I can tell a lot more efficient with eating the lens pieces. I place the chopper around the lens and then pulling it centrally toward the fingertip and performing a cross-chop maneuver, using some vacuum to grab the lens piece, and it emulsifies it really efficiently. So I think that's the trick. You have to have both longitudinal and torsional energy when you're utilizing this simulation eye. So I'm turning the lens, getting the chopper around the lens, pulling it centrally toward the fingertip and fracturing the lens with another cross-chop maneuver, positioning that lens piece at the tip and then fracturing the lens between the instruments and then emulsifying the lens pieces. I'm able to use a vacuum now to efficiently grab the lens pieces and then fracturing it again. Now, another thing I'm noticing here is I'm getting a lot of bubbles. And my suspicion is I'm getting bubbles because, number one, if I use high vacuum in a normal patient, you'll have the eye collapse if you have a mismatch between fluid in and fluid out. And so the eye would normally collapse. But because this is an artificial eye, if I have high vacuum, relatively speaking, it should cause a negative pressure situation. And therefore, because the eye doesn't collapse, it's causing bubbles. And so I think the answer to this situation is really to reduce the vacuum. Again, I didn't really think through why that was happening. I was just doing the case the best that I could at the time. I just filled the eye with some viscoelastic and then I proceeded. So again, if you want to keep the same technique and you get bubbles, then you're just going to have to push viscoelastic in. But alternatively, you could perhaps decrease the vacuum. That's my advice. Again, I didn't try it in these cases. But you saw really efficient lens disassembly, and I was able to get the lens completely out using both longitudinal and torsional energy. And I think with that, we have longitudinal and torsional energy. I think both longitudinal and torsional energy, it does two things. It efficiently eats the pieces, but it also clears the tip much better. And so I think before I was getting some clogging of the tip just using torsional, but by using both, I was able to clear the tip, therefore efficiently eat up the pieces. So go ahead and make my incisions once again. And now this is going to be the terminal chop and cross chop technique. And so as a reminder, terminal chop is like a modified stop and chop. I'm going to make a central groove, and then I'm going to fracture from the terminal side to cut the lens completely in half. And I do this technique on the ultra-brunescent lenses. This helps reduce the risk for a posterior plate phenomenon. So bevel up. I'm sculpting deep, and then I switch to quad. I place the chopper around the lens contra-incisionally, fracturing the lens from the terminal side, and then trying to propagate that fracture all the way through and through. I place the chopper around the right heminucleus, hooking the peripheral lens, crushing the lens against the phaco tip, and this is the cross-chop maneuver. Very efficient, and again, it does do a very good job in simulating the cataract texture, and as far as executing the disassembly portion of this, I think this simulation eye does a very, very good job in simulating the cataract lens material, and as far as chopping the lens and how it behaves, it really does a good job in simulating a real cataract. Using the chopper to loosen up those last fragments from that right heminucleus. And again, because I'm using both longitudinal and torsional, very efficient lens disassembly and removal. Turning that second heminucleus in front of me, placing the chopper around the lens, crushing the lens against the phaco tip. Again, using mechanical fracturing forces to crush the lens into smaller and smaller pieces, and emulsifying the lens piece. All right, so that's the end of that case. I took that cataract piece off and swapped it out with another Okulo 1 piece and mounting it in the Romano eye. You can see the side clips. You just kind of clip it into place. You saw that I placed a cotton tip right there, and I did that because it provided a little bit more stability for the eye within this simulation orbital space. Make my incision. Again, put some dispersive viscoelastic to fill the chamber. Again, you can see the pre-made rhexis. And again, it has been essentially pre-hydrodissected as well. Here's my main incision. Trying to make it a little bit longer that time. Again, I think there's no downside in trying to make a really long tunnel. Lifting the incision, and then I was able to slide it in. Again, not sure why I struggled with the sleeve on that very first case. Here I'm just feeling how loose the lens is. You see, the lens is rather loose. Again, it's pre-made rhexis and a pre-performed hydrodissection. So I didn't have to hydrodissect in this case. Now take a look. For some reason, I did not switch the setting back to both longitudinal and torsional. And so I have no longitudinal on this. Going ahead and sculpting once again. Again, I'm getting a lot of bubbles. Goes back to what I said before. Since the eye doesn't collapse when you activate high vacuum, I think it causes a negative pressure situation, and that mismatch between fluid in and fluid out causes that bubble formation. Reducing that vacuum would make a lot more sense. At this point, I figured out that I made a mistake and I switched, and now I have longitudinal now. I did a sculpt, and now I'm cracking. Switch to quad mode, and this is my dense cataract setting, which by default has both longitudinal and torsional. Performed a cross chop maneuver very efficiently, fracturing the right heminucleus in half, hooking the peripheral lens with the chopper and pulling it centrally toward the phaco tip to fracture the lens against the phaco tip. And this is where I figured out, okay, where is that bottle in the box? That bottle is silicone, and you're supposed to apply that silicone, I believe, on your incisions. I should have also applied it to my paracentesis incision, but by placing that silicone oil, what you're doing is helping to plug any of that fluid coming out. Remember, this is plastic. This is not real tissue. And because of that, when you make an incision in plastic, it tends to stay gaped. And so that's why you get a lot of fluid egress, and you'll notice my fluid volume is really dropping precipitously throughout the cases here. And using that bottle of silicone oil is supposed to mitigate the loss of BSS. Again, using mechanical fracturing to crush the lens into smaller and smaller pieces. You can see I'm using aspiration and vacuum to grab the lens pieces rather efficiently. Because of both longitudinal and torsional energy, I'm very efficiently able to disassemble and remove those pieces. So this is my initial impression. Number one, I think the Bioniko Okulo 1 is great because it has a pre-made rhexis as well as a pre-hydrodissection. And by doing it this way, you have a fairly mobile lens. You don't have to worry about the rhexis. It's really just entirely focused on lens disassembly. You also have excellent behavior of the artificial cataract. It does behave like a soft cataract. You can sculpt it, you can chop it. When you break it up, it fractures and it feels like real cataract lens material. You might not have all the same layers of cortex, epinucleus, endonucleus like a real cataract does, but I think by and large, this is a really good simulation of cataract lens material. You need both longitudinal and torsional ultrasonic energy to really efficiently disassemble the lens and remove the lens pieces. Again, you have to think about adjusting your vacuum to minimize the bubbles. I also mentioned considering adjusting the vacuum and lowering the vacuum to minimize bubbles based upon the fact that this artificial eye does not collapse naturally like a real eye. And then consider making a longer incision. Use silicone oil that's provided to cover over those incisions to help tamponade any fluid egress. So again, this is my first impression of the new Bioniko Okulo 1 model for cataract surgery lens disassembly. And I do believe this is an excellent simulation model for lens disassembly for cataract surgery. So I hope this was helpful to you, and I thank you for your attention.